Bismillahirrahmanirrahim. Quote of the day is that a negative mind will never give you a positive life. Today, the topic of my presentation is integrated management of newborn and childhood illness, and I'm presenting it under the supervision of my professor, Dr. Saira Afsar. Learning outlines are introduction of IMNCI, aims of IMNCI, components of IMNCI, principles, IMNCI processes, guidelines, and recent trends. At the end of this presentation, participants will be able to describe the introduction, aim, components, principles, and guidelines of IMNCI. Introduction. 10 million children per year die in the developing countries due to acute respiratory infections, diarrhea, measles, malaria, and malnutrition. Out of these children suffer from one of these 5 conditions. Integrated management of childhood illness is a systematic approach to children's health which focuses on the whole child. The approach was developed by the United Nations Children's Fund and the World Health Organization in 1995. It includes both the preventive components on the part of families and communities, as well as curative actions that are taken by the health workers. Pakistan adopted as MNCI. Now, what is IMNCI? IMNCI is an integrated approach to child health that focuses on the well-being of whole child. It includes both preventive and curative elements that are implemented by families and communities. IMNCI offers a holistic approach to manage childhood morbidity through 3 components. IMNCI in Pakistan. Pakistan is implementing this strategy since late 90s, but not at the required scale. Since 2001, it has only been implemented in 10 districts across Pakistan. Objectives of IMNCI. 3 main objectives are to reduce mortality, to reduce frequency and severity of illness and disability, to improve growth and development during the first 5 years of child's life. Components of IMNCI are health worker component, improvement in overall health system, and improvements in family and community healthcare practices. What is difference between IMNCI and IMCI? IMCI has the feature of that it covers from 0 to 6 days, that is early newborn period. While in IMNCI, it is not considered, well, it is considered in IMCI. Basic healthcare module is not followed in IMCI, while it is followed in IMNCI. Home visits by provided for newborns and young infants are there. Training and home-based care is also provided in IMNCI. Training days for newborns and young infants, that are 4 out of 11 days, are followed in IMNCI. Sequences training is IMNCI, newborns and young infants that are 0 to 2 months age, and then child from 2 months to 5 years of age. While in IMCI, child 2 months to 5 years of age, then young infants 7 days to 2 months of age. Guidelines for IMNCI. Evidence-based syndromic approach to case management includes rationale, effective and affordable use of drugs and diagnostic tools. An evidence-based systematic approach can be used to determine the health problems the child may have, severity of the child's condition, and actions that can be taken to care for the child. For example, refer the child immediately, manage with available resources, or manage at home. In addition, IMNCI promotes the adjustment of interventions to the capacity of health system and active involvement of the family members and community in the healthcare process. Rationale for an evidence-based syndromic approach to case management. Many well-known preventive and treatment strategies such as childhood vaccination and ORT has already proven effective for saving young lives. Effective antibiotics may have saved millions of children with pneumonia. Prompt treatment of malaria has allowed more children to recover and led healthy lives. Even modest improvements in breastfeeding practices have reduced childhood deaths. Accumulating evidence suggests that a more integrated approach to manage sick children is needed to achieve better outcome. Child health programs need to move beyond single disease to addressing the overall health and well-being of the child, because many children present with the overlapping signs and symptoms of the disease. A single diagnosis can be difficult and may not be feasible or appropriate. This is especially true for first-level health facilities where examination involves few instruments, little or no laboratory tests, and no X-rays. During the mid 1990s, the World Health Organization, in collaboration with UNICEF and many other agencies, institutions, and individuals, responded to the challenges by developing a strategy known as integrated management of childhood illness. Principles of IMNCI. First principle is all sick children under 5 years of age must be examined for conditions which indicate immediate referral or hospitalization. Second principle is children must be rationally assessed for major symptoms, nutritional and immunization status, feeding problems, and potential problems. Third principle, only a limited number of carefully selected signs that are used based on evidence of the sensitivity and specificity to detect disease. Based on the presence of selected clinical signs, the child is placed in classification. Classifications are not specific diagnoses but categories that are used to determine the treatment. That is referral, treatment, and consultant management at home. Principles of integrated care. Occupation of the individual sign leads to child classification rather than the diagnosis. First is that it needs urgent hospital referral or admission. It is classified as and color coded pink. If a child needs a specific medical treatment or advice, it's classified and coded as color yellow. And if it can be managed at home, then it can be color coded as green. A limited number of essential drugs are used. This is the principal 6. Caretakers are actively involved with the treatment of children. Counseling of the caretakers about home care, including feeding, fluids, and when to return to a health facility. Goals of IMNCI. Standardized case management of sick newborns and children. Focus on the most common cause of mortality. Nutrition assessment and counseling for all sick infant and children. Home care for newborn to promote exclusive breastfeeding, prevent hypothermia, improve illness recognition, and timely care seeking. IMNCI case management process. It is said to assess, then classify, then identify treatment, then treat, then counsel, and then follow. IMNCI package. IMNCI package guidelines recommended that standardized case procedure consists of 2 categories. First is up to 2 months and second is from 2 months to 5 years. Care of the newborn that are under 2 months. Keeping the child warm, initiation of the breastfeeding immediately after birth and counseling for exclusive breastfeeding and non-use of pre-lacteal feed. Cord, skin and eye care, recognition of illness in newborn and management or referral, immunization and home visits in the postnatal period. The integrated case management process is check for the danger signs, then assess main symptoms, and then assess about nutrition, immunization status, and potential feeding problems. Color coded pink are those that are for urgent referral, yellow are that like local infections, oral drugs are given, advice and teaching of the mother and then follow. While in green color, home management and considered. IMNCI case management process. Steps of case management are assess the child, young infant or child, classify the illness, identify the treatment, treat the young infant, counsel the mother, provide follow-up care. IMNCI, what does it offer? Assessment and classification of all children presenting to the physician. Initiating treatment for all children, counseling, initiate drug treatment, pre-referral treatment, and referral advice for serious conditions, management where referral is not possible. AIDS in IMNCI guidelines. AIDS is not addressed specifically in IMNCI when a child who is believed to have HIV parents with any of these common illnesses, he can be treated like any other child coming with the illness for the first time. If a child's illness does not respond to standard treatment, or if a child becomes severely malnourished or returns to a clinic repeatedly, he is referred to a hospital for special care. Assess, classify, and treat the sick young infant aged up to 2 months. That do a rapid appraisal for all the waiting infants, and you then use all boxes that match its infant symptoms and problems to classify the illness. Check for possible serious bacterial infections or very severe disease, pneumonia, or local infections, and then classify as possible serious bacterial infection or very severe disease, pneumonia, local infection, or severe disease or infection that is unlikely. Then check for jaundice. Ask that when did jaundice first appear. Then look and feel is for that. Look for jaundice and look at young infants' palms and soles. Are they yellow? And then classify jaundice. Three types of severe jaundice classification in jaundice and no jaundice at all. Then ask, does the young infant have diarrhea? If yes, then look and feel. Look at the young infant's general condition, infant's movement. Does the infant move on his or own? Does the infant move only when stimulated, but then stops, or does the infant does not move at all? Then classify diarrhea for dehydration, severe dehydration, some dehydration, and no dehydration. Then check for feeding problems or low weight for age in breastfeeding infants. Asking is if the infant breastfed, if yes, how many times in 24 hours. And feeling is weight may be less than 1.5 kgs or weight may be less than -3 z score. Look for ulcers or white patches in the mouth. That may be a sign of thrush, that is fungal infection. Feeding problems are for low weight for age, or there are no feeding problems, or very low weight infant are found. Then check for the feeding problems or low weight for age in infants that are receiving no breast milk at all. Questions that need to be asked are, what milk are you giving? How many times during the day and night? How much milk is given at each feed? How are you preparing the milk? Let milk demonstrate or explain how fed is prepared and how is going to give given to the infant. How is the milk being given, cup or bottle, and multiple questions. And after that, look and listen for determine the weight for age. If weight is less than 1.5 kg or is less than -3 z scores. Then check the young infant's immunization status. Immunization schedule is at birth, BCG is given at 6 weeks, DPT, HP influenza virus, and Hep B and oral polio vaccine is given. And in 10 weeks, DPT, HIV, hepatitis B virus, rotavirus vaccine, pneumococcal conjugate virus vaccines are given according to the IMNCI schedule. Now treat the young infant and counsel the mother. If the young infant is classified as possible serious bacterial infection or very severe disease, give pre-referral treatment and refer urgently. First is to give dose of intramuscular gentamicin and oral amoxicillin. Gentamicin is the desired range is from 5 to 7.5 milligram per kg in one daily infection. Doses for the gentamicin and amoxicillin is according to the weight of the child. If weight is 1.5 to 2.4, then it's 0.4 ml. And if it's 2.5 to 3.9 kg, it's 0.8 ml per kg. And if it's 4 to 5.9, it's 1.5 ml. Treat the young infant to prevent low blood sugar. If the young infant is able to breastfeed, ask the mother to breastfeed the young infant. If the young infant is not able to breastfeed but is able to swallow, give express breast milk before departure. If not possible to give expressed breast milk, give sugar water. If the infant is not able to swallow, Give 20 to 50 ml of express milk or sugary water by NG tube. Third is teach the mother how to keep the young infant warm on the way to the hospital. Provide skin to skin care. Keep the young infant clothed or covered as much as possible all the time, especially in cold environment. Uh, Dress the young infant with extra clothing, including head, gloves, socks, etc. Urgent referral with the write a referral note for the mother to take to a hospital if the infant also has some dehydration or severe dehydration and is also able to drink or not. Also mention it in the letter. Treat the young infant with severe dehydration quickly with the plan C. Like if you can give IV fluids immediately, if yes, then give them. And if no, is IV treatment available nearby within 30 minutes? If it is available, then urgently refer the patient to the hospital for IV treatment. And if it is also not available, then a trained person is asked to pass the NG tube for rehydration. If even NG is not available, can the young infant drink? If it's not, then refer urgently to the hospital for IV or NG treatment. Where referral is refused or not possible, further assess and classify the sick young infant with possible serious bacterial infection or various disease. Young infant at any age may have the following, like convulsions, unable to feed at all, no movement, or unable to cry, bulging fontanelle, or cyanosis. This is or are the signs of critical illness. And the severe pneumonia signs, a young infant is fast breathing, 60 breaths per minute or more, or infant in less than 7 days old. Where referral is refused to or not possible, treat the young infant who has clinical severe infection with gentamicin and amoxicillin. Give intramuscular gentamicin to young infant with clinical severe infection where referral is refused to or not possible. And give oral amoxicillin where referral is refused or not possible according to the weight and age. Give pre-referral treatment to the young infant who has critical illness and refer urgently to the hospital. Now, treat the young infant, teach the mother to give oral medicines at home. Train the young infant in counseling of the mother is the most important thing. Teach the mother how to treat local infections at home, how to treat skin, pustules, or umbilical infection, how to treat thrush, and immunize every sick young infant as needed. Treat the young infant and counsel the mother in which also is found to treat the young infant with diarrhea, give extra fluid and continue feeding. Plan A is treat diarrhea at home. Plan B is treat some dehydration with ORS, and Plan C is already discussed that urgent referral is required. Well, to treat diarrhea at home, counsel the mother on the rules of home treatment for young infant, give extra fluid and when to return to the hospital to tell. Counseling of the mother advise the mother to give home care for young infant, exclusively breastfeed the young infant. This is for breastfeeding mother. Give only breastfeed to the young infant. Breastfeed frequently, as often as long the infant wants, day and night or during sickness and health. Give 5 follow-up care for the young infants. Clinical severe infection where referral was refused or not possible, and follow-up for the new contact for injection up to 2 days and on day 4 of treatment. At each contact, reassess the young infant. If follow-up care is in for the local infection on day 3, look for the umbilicus. Is it still draining or is it dry? Look for the skin pustules. If umbilical cord is having pus and redness and remains same or is worse, it should be referred to the hospital. Jaundice on day 2, look for jaundice. If palms and soles are yellow, refer to the hospital. If palms and soles are not yellow but has jaundice, has not decreased, advise the mother about home care and ask her to return for follow-up again tomorrow. Diarrhea for diarrhea on day 3, ask how's the diarrhea stopped. If the diarrhea has not stopped, assess and treat the young infant for diarrhea. And if diarrhea has stopped, tell the mother to continue exclusive breastfeeding. If the baby is low weight for age on day 14 or on day 7, if the infant is receiving breast milk or not. Weight the young infant and determine if the infant is still low weight for age. Reassess the feeding, then check for feeding problems or low weight for age. If a patient is having thrush on the day 3 of treatment, thrush is getting worse, infant has the problem with attachment or suckling, refer to the hospital. If thrush is in the same or better, or if the infant is feeding well, then continue half strength gentamicin volley for a total of 7 days. Now coming towards the recent advances. Recently, an article published is the evaluation and effectiveness of IMNCI 7-day course versus standard 11-day course in Pakistan. This was the cost experimental study in two provinces, that is in Sindh and Punjab. 104 healthcare workers were conveniently selected to receive either the 7-day or 11-day package. It shows that an improvement in mean knowledge score was 31.6, while the improvement in mean clinical scores for 7-day and 11-day training group was 23. That is the 7-day training is equally effective as standard training. However, the training for certain illnesses may be better delivered by the standard course. Another article published is integrated management of neonatal and childhood illness strategy in Zimbabwe. That is an evaluation. This shows that more than 5 children under the age of 5 die each year worldwide, primarily from preventable and treatable causes. In response, the WHO's integrated management of childhood illness strategy has been adopted in more than 95% low and middle income countries, 41 of them from Africa. Despite IMNCI's widespread implementation, evidence on its impact on child mortality and institutional deliveries is limited. The study examined the effect of IMNCI strategy in the context of Zimbabwe, where neonatal and infant mortality rates are amongst the highest in the world. Now coming towards the MCQ session. First MCQ is, a mother brings his 10 years old infant in the pediatric emergency department with the symptoms of headache, nausea, vomiting, difficulty in the crying and distress and loss of balance. Mother also gave history of fall from the bed of child and physical finding, there is respiratory distress. Blood pressure is less and Glasgow Coma scale is 10/15. The child should be managed according to the guidelines of option A, essential newborn care. Option B, integrated management of newborn and childhood illness. Option B, integrated management for emergency essential trauma care. Option D, pregnancy, child and postnatal care. And option E is emergency obstetric care.
B.
Option C is the right one. It should be treated for emergency essential trauma care. A public health expert team found that inadequate health system support and lack of trained health staff were the main constraining factors that are associated with the implementation of IMNCI strategy at primary healthcare facilities in the Lahore district in their research project. Which level of integration needs improvement in this scenario? Option A, patient and healthcare delivery levels. Option B is healthcare system level. Option D, at primary and community level health practices. And option D, patient and healthcare system level. C. Option D is the right one, patient and healthcare system levels. A 2-month-old male infant with a history of sunken eyes, mild or no movement at all, and very slow pinching of skin, less than 2 seconds is found. This is classified as which in the IMNCI? Option A, some dehydration. Option B, moderate dehydration. And option C, severe dehydration. And option D, no dehydration.
C.
Yes, option C is the right one. It is considered in severe dehydration. Fourth MCQ is, a newborn child aged less than 24 hours with a history of yellow coloration of skin. Which color in the color coded triage system of IMNCI is used to classify a child illness in this scenario? Option A, yellow. Option B, orange. Option C, green. And option D, pink.
Yellow. A.
Yes, this is the right answer. A 1-month-old child with a history of more than 60 breaths per minute, chest in drawing, looking lethargic and unable to feed. She has option A, cough, option B, pneumonia, option B, severe pneumonia, and option D, very severe pneumonia.
C.
C. Severe pneumonia.
Yes, option C is the right one. Sixth MCQ is a 1.5-month-old child age presented in pediatric emergency with a history of excessive crying and ear discharge for last 5 days. Which color in the color coded trial system of IMNCI is used to classify the child illness in this scenario? Option A, yellow, option B, orange, option C, green, and option D, pink.
D.
Uh, Option A is the right one, yellow is the right. Because the child needs treatment and he's having an infection that is not in pink are the those that urgent referral is required and very high severe disease. Seventh MCQ is a newborn baby looking irritable and restless, also have sunken eyes and the skin pinch goes back less than 2 seconds. Child also has history of loose watery diarrhea for last 2 days. The child should option A, give food and fluids only. Option B, give zinc supplementation. Option D, first dose of antibiotic is given. And option D, refer urgently to the hospital and continue breastfeeding and frequent sips of ORS on the way.
D.
D.
Yes, option D is the right one. Eighth MCQ is a 6 weeks HIV positive male child presented in the pediatric emergency with a history of pain and ear discharge for more than 14 days. Child also mixed a vaccination of EPI. The doctor should option it treat the child infection with the ear drops. No treatment is required in this patient. Option C is give oral polio virus and the BCG vaccination. And option D, treat the child with ear drops and complete all missed doses of EPI vaccination except BCG.
D.
Yes,
D.
option D is the right one. Ninth MCQ is a 1-month-old baby had symptoms of bloody diarrhea with belly cramps, fever, nausea, and vomiting for last 3 days. On examination, the child has sunken eyes, mild or no movement at all. The child had option A, diarrhea, option B, dysentery, option C, food poisoning, and option D, salmonellosis.
B.
D.
Yes, option B is the right one. Last MCQ is a 1-year-old child had low appetite and edema of both feet for 1 week. On examination, weight for height is less than -3 z-score and mid-upper circumference is less than 15 mm. The child should option A require no treatment, option B offer the child ready to therapeutic food after assessing appetite, option C child should manage at home, and option D refer the child urgently to the hospital.
B.
Option D is the right one because the height is less than this -3 z-score and he is having malnourished. This is the key and thank you.
Thank you very much, Dr.